Hello, I'm CJ Davis, President CEO of Burl Behavioral Health. Thank you for joining me. We are encountering a pandemic in our communities, requiring us to adapt the way we live, adapt the way we connect with others, and adapt our lifestyle. We're all making personal sacrifices, we're all experiencing compassion towards others, and we're all making personal sacrifices for those around us. The one thing that we're not talking about, however, is the anxiety associated with the coronavirus, what we like to call A-COVID, or anxiety of COVID. And we're encountering three groups of people right now. Those that are just have general fear as a result of the COVID virus, those individuals that experiencing a pre-existing mental health condition with the COVID virus, and then of course we have children and adolescents that have fears associated with the COVID virus. Let me begin by talking a bit about the individuals experiencing fear. It's natural to have anxiety during these moments. It's natural to feel like things around you are catastrophic, and there's a significant amount of fear that we can have associated with something that feels largely out of our control. If you experience symptoms like general worry, changes in your appetite, difficulties concentrating, difficulties sleeping, then that would signal perhaps that you would want to reach out to one of our offices. Of course, those folks with a pre-existing mental health condition, we're always there for you, and we want to continue to be there for you. We want to make sure that during this crisis that you have access to care regardless of your ability to leave the home. Social distancing does not mean social isolation. We need to make sure that we are emotionally connected to people. And part of that emotional connection is to remain in care. Now, if you're scared or fearful of going out in public, Burl Behavioral Health has the ability to offer telephonic services instead of coming into our offices. If you believe that attending a face-to-face session is a better route for you and a better form of care, then that's okay too. Our staff is ready and willing to provide service. We want to really make certain that anybody that needs care right now has the ability to receive care. And in fact, most of the traditional barriers associated with accessing mental health services, such as transportation, are presently and temporarily completely eliminated. You need a session with your therapist, you need a session with your doctor. We have the ability to provide that care over the phone. And when speaking of children and adolescents, we really encourage you to talk to your kids at home about the coronavirus. Talk about how you're feeling. Don't make it a taboo topic. If as adults we're experiencing fear and apprehension, our kids are experiencing fear and apprehension. I want to remind everybody that the second leading cause of death for adolescents in our state is suicide. We can't lose sight of the fact that people need to remain in services. Our services also in our offices, we've taken significant precautions to ensure your safety and the safety of our employees, including hand washing stations outside of every one of our locations, signage, health screenings, and additional hand sanitizer. And by the way, when you walk into one of our offices, you may see our waiting room have less chairs, and those chairs will now be 6 feet apart to practice social distancing. We can get through this together, and remember, Burl is always there. Access has never been easier for mental health and addiction services. Remember, social distancing does not mean social isolation. Stay connected, stay in care. Thank you.